How to eat from a diagnosis of arthritis and recommendations. As my dear friends are in this opportunity, we will continue talking about arthritis because it is a very complex disease. We will give you the best recommendations so that you can take this disease in the best possible way. General recommendations for rheumatoid arthritis. Avoid stress, both mental and physical, caused by intense physical exercise. Sleep between 8 and 10 hours at night and take a 30-minute nap. Start the day with a hot water bath to reduce stiffness and seizure in the morning. Avoid performing very repetitive movements, especially with your hands. Avoid standing for many hours. Do not perform much force with your hands, for example opening jars, scrubbing, wringing clothes, etc. In short, the symptoms can be improved with a good nutritional intervention and a relaxed and healthy lifestyle. Nutritional assessment of people with rheumatoid arthritis. It is common to find a relationship with allergies to certain foods and poor absorption of nutrients in the intestine. This intestinal problem can cause the lack of some nutrients that worsen the disease. In addition, many people with arthritis have inappetence caused by a lack of salivation and end up eating less than they should. Being a disease that occurs with inflammation, there is an increase in the metabolism of the person. That is, more calories are burned and nutritional needs increase. As a consequence of this state, the weight, the musculature, and the immunity of the person decreases. For these reasons, nutritional treatment through diet is essential to achieve recovery. All these symptoms occur when you have time with this disease. Relationship between arthritis and other diseases related to food. As it is a chronic disease that appears at an early age, the continuous use of medications is frequent. It can cause a peptic ulcer and gastritis. It can also appear decay, alteration of taste and smell caused by a decrease in the secretion of saliva. In addition, some people can also suffer an alteration in the jaw joint that limits the opening of the mouth to eat. Dietary recommendations for rheumatoid arthritis. The most important thing to keep in mind to treat arthritis with a healthy diet is: make a diet rich in antioxidant vitamins and minerals, vitamin A, C, E, minerals such as zinc and selenium. Eat foods rich in carotenes, carrot, pumpkin, mango, papaya, peach, apricot. Eat foods such as fruits, vegetables, legumes, tubers such as potatoes, olives, nuts. Dry fruit, honey, and acidifying food. Decrease all cereals, meats, sausages, peanut derivatives, fish, although less. Consume essential fatty acids that are natural anti-inflammatories, the famous omega-3, present in blue fish, walnuts, and flax seeds. Decrease the consumption of saturated fats, red meats and sausages, whole milk products, cream, butter, margarine, cream. Always use virgin olive oil. Make nutrient-rich food that is often a deficit caused by weight loss. Magnesium, manganese, zinc, selenium, vitamin A, D, E, B12 and phosphates. Control food that may cause an allergy or intolerance. Sometimes an intolerance to carbohydrates can appear that must also be controlled through diet and supplementation. An improvement in inflammation has been observed when low-salt diets are made 1,200 mg of sodium per day. In addition, they also improve the side effects of certain medications, such as corticosteroids. They tend to cause high blood pressure and fluid retention. It is recommended to change dairy foods for calcium-enriched soya substitutes. The main source of protein should be from legume, fish, egg, white meat, and prepared from soy. 1. The salmon. Salmon is a source of omega-3 fatty acids, since it helps to reduce inflammation of the joints. Fish oils rich in omega-3 can also help prevent inflammation. It is convenient to avoid eating fried, breaded or prepared fish with fatty sauces. 2. Olive oil and vinegar. It is advisable to avoid dressings with cream, butter, or hydrogenated oils. Using olive oil and vinegar as a dressing helps prevent joint pain. Also, olive oil is excellent for its content in polyphenols, which are antioxidants that help prevent inflammation of the joints. 3. Vinegar with honey, an ancient remedy. A home remedy against arthritis suggested by Dr. Jarvis DeBar, a few decades ago. It suggests taking a mixture of apple cider vinegar and honey daily. It can be taken diluted in a glass of warm or warm water of 8 ounces 250 milligrams. And mix a teaspoon of apple cider vinegar and a teaspoon of honey. For guava, kiwi, and citrus. To strengthen the cartilages that cover the bones and joints and to avoid pain and inflammation, an adequate consumption of foods with vitamin C is necessary. Eat fruits like guava and kiwi. It is also found in broccoli, strawberry, orange, grapefruit, tangerine, among others. 5. Ginger. Ginger, so common in Japanese and Chinese food, helps reduce knee pain from osteoarthritis and has anti-inflammatory properties. It is used in preparations such as chicken or salmon teriyaki, sushi, chicken ginger, among others. Likewise, it can be taken in teas or topically applied some ginger ointment to help mitigate pain and inflammation. 6. Garlic. Garlic has anti-inflammatory properties, according to a study being carried out by the University of East Anglia. They suggest of 2 or 3 cloves of garlic daily, preferably raw, which can be included in the daily preparations. 7. Broccoli. Broccoli is a protector, as it can help delay the development of osteoarthritis. It contains a compound that can block the enzyme that causes damage to the joints according to research from the University of East Anglia. In addition, broccoli contains vitamin C that helps prevent inflammation of the joints. 8. Low-fat milk, cheese, and yogurt. It is necessary to consume low-fat milk, cheese, and yogurt daily for its contribution of calcium to ensure that the requirements of this mineral are met. It is also very important to ensure that you have an adequate supply of vitamin D. Either by fortified foods, by complement, or by daily exposure to the sun for 10 to 15 minutes. 9. Cranberry and cranberry juice. It is recommended to drink a glass of cranberry juice every 6 hours. In research conducted by the University of Wisconsin, the anti-inflammatory properties of proanthocyanidins, found in cranberry and cranberry juice, are observed. 10. Avoid sardines, mussels, anchovies. If arthritis is due to high levels of uric acid, gout, it is convenient to restrict foods high in purines, especially in the acute stage. Avoid eating sardines, mussels, anchovies, caviar, guts, mackerel fish. Extracts of meat, consommes, and restrict alcoholic beverages. Moderate the consumption of fish, poultry, meat, fish, and seafood, asparagus, lentils, beans, mushrooms, peas and spinach. Well, my dear friends, I hope this information completes all your expectations. If you liked it, do not stop giving it and subscribe to my channel. Send me your suggestions of new topics and do not forget to share it with all your friends and family. A million thanks and many blessings, a big hug and best wishes to all of you.